Good morning. I'm wondering if you have experienced any clicking or popping in your jaw, or if you have this unrelenting ear pain that kind of feels like an ear infection that just won't go away. If you have those symptoms, or if you grind your teeth or clench your jaw, especially at night, you might be experiencing problems with your TMJ. If you guys don't know me already, my name is Dana. I am a physical therapist here at Smith Physical Therapy Plus in the Balance and Concussion Center, and I work with individuals all the time who have problems with their TMJs. So what exactly does that mean? The TMJ is short for your temporomandibular joint, and that's your jaw right here. Everybody has a TMJ. In fact, everybody has two TMJs. You have one on the right and one on the left. And I brought my friend the skeleton here to help illustrate what the jaw looks like. But you have one on each side, and the joint itself sits right in front of the ear. So you can see how when you open and close your mouth, if there's an irritation happening in that joint, how that can radiate up into the ear, sometimes up into the head and causing additional headache symptoms, or it can go down the face and into the neck. The jaw itself is unique because both sides have to work at the same time. So the right and the left side ideally should be working in a partnership together to allow you to open and close your mouth all the way. And if there's a problem on one side or the other, it will affect the jaw and it will affect both sides of your mouth. So you can have problems with talking, yawning, chewing, and eating, all of those things. So a lot of people don't even know that there is physical therapy for TMJ problems, and we call those problems collectively TMD, or temporomandibular dysfunction. And so there's a lot that we can do to start treating TMD. It's not something that you need to live with, which is wonderful. Again, let's review some of those things that can contribute to those problems in the jaw. So it can happen after trauma, if you bump your head, or a car accident, or a fall, or a sports injury. We can see problems to that joint happening. It can be muscle weakness or arthritic changes in the joint. Or again, if you're one of those teeth grinders or clenchers, if you hold all of your stress up in your neck and in your face, and you clench your teeth at night, then you might start to experience some problems in the jaw. A lot of times people with this go to their dentist, which is great, and they get mouth guards, which is wonderful because that helps protect your teeth when you're clenching and grinding your teeth at night. The problem is that chronic clenchers oftentimes will bite through those mouth guards. So we need to do something to relieve the pressure in that joint and allow for better function. A lot of people also will start to experience sticking in the joint where they can't open their mouth all the way, or they can't close their mouth all the way. And you can only imagine how many problems that gives you with eating and talking, and it's quite uncomfortable as well. So there are some things that you can start doing right away to help manage that TMD that you have developed over the years. So the first tip is be mindful of your posture. As we sit, a lot of us sit, most of us sit with a very forward posture. So our heads come in front of our shoulders while we work on our computers, or while we're on our phones or tablets. And keeping an upright posture helps take pressure off of the jaw itself. So keeping an upright posture and keeping that head tucked back will help decrease pressure to the jaw itself. One of my favorite exercises for that is called neck retraction. And to do that, it's super flattering, but you sit up as nice and straight, get your shoulders down and back, and then you pull your head straight back. You hold that position for about 5 seconds and then relax. When you relax, make sure that you're not jutting your head back out forward. It's just from an upright posture and then pull back a little bit farther, and then relax. It's, again, super flattering. Like I said, gives you a nice double chin when you do that one correctly. I like to do that one in the car at stoplights. You can use the headrest in your car for a little bit of feedback. You can tell if you're pushing your head back into the headrest that you're doing that one correctly. So that's tip number one, is watch your posture and try and get those ears back over your shoulders the best that you can. The second thing that you can do is called a masseter release, and this is kind of a self-massage technique that you can do. So number one, what is the masseter? The masseter is a muscle on each side of your jaw, and it helps close your mouth. So when you squeeze your mouth together, you can see this muscle pop out on the side of your face, and you can feel it right here. And when you clench or grind your teeth, that muscle gets overworked and it likes to stay tight. So what you can do is use a couple of fingers and massage over that joint in a forward, or over that muscle in a forward and backward direction. And you can do that for a few minutes, a couple times a day. The other thing that you could do is, if both sides are tight, is you get your fingers in your cheeks, right below your cheekbone. And as you open your mouth, you pull your fingers down along that muscle, like this. And you do that 6 to 10 times, and you can repeat that as many times as needed throughout the day to try and help release that masseter muscle. The last tip that I'm going to give you, it's called controlled opening. And I'm going to use the model really quick to explain how the jaw moves. So the jaw itself can opens like this, where it rolls. But then when you open your mouth all the way, like to get a big cheeseburger or a sub sandwich in there, you have to, there's a roll motion in the joint, and then it actually has to slide forward. So it pops forward in the joint itself. I hope you can see that happening there. It's typically that forward sliding motion that causes the most irritability in the joint, because the disc that helps protect the joint has to be able to move too. So when the joint is really irritable and painful, what we do is called controlled opening. And I'm going to explain this one first because I cannot talk and demonstrate this one at the same time. So to do controlled opening, you put your tongue on the top of your mouth behind your front teeth, and you're going to open and close your mouth in a controlled manner, the best that you can, trying to keep your jaw straight. So opening it straight down and straight up, and it looks like this. So when I do that one, my tongue stays on the roof of my mouth. And this is a nice one because it allows the mouth to open and close. It allows the jaw to work through that rolling motion, but it keeps it from sliding forward. And we recommend when the jaw is really irritable that you don't open your mouth any more than that amount until symptoms start to calm down. Also be mindful of, if you're a gum chewer or you like to eat crunchy or chewy foods, when the jaw is acting up and sore and painful, it might not be the best thing to do those things. Try and stay away from that until your pain starts to come down. As always, if you have any further questions about TMD, or if you're having pain in your jaw, please get a hold of me. I am more than happy to set up a discovery session with you, or get you some physical therapy, or direct you in the right direction for your next best step in your care. So again, I hope you have a wonderful day. Thanks for joining me this morning, and I hope none of you have any clicking, popping jaws or any ear pain. And if you do, please come and see me. I'm more than willing to help. You guys have a great day. Thanks for joining me. Bye-bye.